Hi, this is Dr. Anderson, and I'm here with Lori, and we're going to go over something I saw just spontaneously. We decided to do this video because Lori's diabetic, and she's going to have nerve decompression surgery for her neuropathy. And one of the things that I talk a lot about is the fact that patients with diabetes, their nerves swell. They have larger nerves when they're diabetic than if you're not diabetic. And oh, by the way, we're all wearing masks because it's at the kind of hopefully it's towards the end of the whole coronavirus era in our country, and but we've been cleared to let her and other people start having surgery. But we're all wearing masks and such. So I'm going to point out really quick before we go much further. If you could come around here, what I did with her, I had this ultrasound machine that we used, the head right here. And then if you can pan over here, we actually evaluated her common peroneal nerve, which is in that area. That area is what we're looking at on the monitor. And the common peroneal nerve affects everything on the top of the foot, in front of the leg. And so I'll kind of explain, we got tape here to cover up her name, but this is the nerve itself between those two lines. And I'm actually going to remeasure this real quick to show you guys what we look for. So the nerve is coming down along an area here, and all along that area it's in a tunnel. So there's an area maybe on the monitor, if we looked, it'd be about that long. But there's one particular area where the nerve is diving into and underneath a muscle compartment where it really gets pinched down and the size is diminished considerably, and that's about right here. So we're going to measure the difference. Again, this is the nerve and it's coursing down towards the foot, back up towards the hip that way. So right in here, you'll see, I'm going to measure this. And so right there is right where it starts to dive beneath the muscle. And we're going to get a measurement of about 4.5. Okay, so 4.5 millimeters, and that's going to go away now. And then we're going to come out here. And this is going, again, down towards the foot. Further, we're just going down a little bit ways, and it's 5.5. So you can definitely see, you don't even have to measure, but you can see the change. And I call this the hourglass effect or the napkin ring effect. So it's a really neat thing to show. And it's interesting too, because her nerves or that nerve is appreciably larger than somebody coming in for this surgery that is not diabetic. The numbers that we're getting there, are kind of in the 4 to 5 or 6 millimeter range, and normally it's going to be more like 3 to 4. So that even shows that there's definitely nerve swelling in there. And as a surgeon, it's something that we appreciate when we're in there. We see this quite often, but it's fun to be able to share this with patients and really kind of gather more data as to how much these nerves are getting compressed. Because as we say, seeing is believing. So and I want to thank Lori for taking the time. She's been here a while today so we can do this video, and hopefully maybe we'll see in her video afterwards, because we like to share this great information that we're able to help these people that are suffering from both diabetic and non-diabetic neuropathy. So I hope that was useful information for you. If you have any comments, please post those, and again, I always ask you to please consider subscribing to our YouTube channel. So again, thank you for taking the time to watch.